All right. Okay, so for the class, I'll just simply be explaining to you guys the last activity that we had, okay, regarding intermittent IV bolus dosing. Okay? Kasi class, in relation to IV infusion, intermittent IV infusion, okay, very important kasi yung topic na naiintindihan natin. Okay, so let's start off class with the first problem that we had, okay, on our activity. So, a 33-year-old male patient weighing 55 kilograms was rushed into the ER due to severe fever with low blood pressure and decreased respiratory rate. So, looking at this patient right now, class, you can see na medyo emergency na yung kanyang situation. Okay? Kumbaga, hindi na pwede magpapetiks-petiks pa. Kasi ang baba na ng BP niya, which is already dangerous in and of itself. Okay, tapos mabagal pa yung paghinga ng patient natin. So after the patient was stabilized in the ICU, his lab results arrived and shows that the patient has septicemia with gram-negative bacteria. So, if a patient class is presenting with gram-negative bacteria, okay, amongst the, actually, dalawa lang naman yung antibiotics na meron tayo dito. Okay, sa tingin nyo class, sino sa dalawang ito ang magandang gamitin for gram-negative bacteria? Okay, anyone can answer? Right? Which do you think is better class for gram-negative? Gentamicin or penicillin G?
Gentamicin po.
Alright, very good. Sa tingin mo, bakit gentamicin?
Narrow yung spectrum lang po ng Benji. And mas madali po siya ma-degrade yung cell wall po niya.
Okay. Alright, sige, pwede na rin yun. Okay, now one thing you have to remember, class, thank you very much, okay, for answering. Si Miss ba? Si Tony ba yun? Sino ba yun? Sorry.
Yes po, sir.
Okay, thank you, Tony. Alright. So, tama rin naman yun. Okay, I guess, I can't really say na narrow ang spectrum ng gentamicin. Medyo broad siya ng konti. Okay? Pero basically, class, gentamicin kasi is very effective against gram-negative bacteria. Pen-G, on the other hand, kasi is more effective against gram-positive bacteria or any bacteria class that contains cell wall. Okay, most of the time kasi class with gram-negative bacteria, they don't have cell walls. They have mostly your cell membrane. Okay? So, gagamit lang tayo ng gentamicin, which is a aminoglycoside. Yeah. So, anyway. So, in this case, class, it was already decided that the patient will be started on gentamicin IV push. Now, another thing, class, that I want to point out here nga pala is that with gentamicin, class, we don't really give it as IV push intermittently. Okay? Normally, class, we give it as IV infusions, intermittent IV infusions. Pero sabi ko, gusto ko lang magbigay ng example dito. So, kunwari lang, okay, binigay natin siyang IV push. Pero again, class, in reality, especially in a clinical setup class, we don't usually give gentamicin as IV push. We give it mostly as intermittent IV infusions. Kasi masakit yung gentamicin class pag pinush mo. Okay? It's going to be painful for the patient. Okay? At the same time, clients, it's going to be, it's not going to be a pleasant experience for the patient. Well, sino bang may pleasant experience pag na-hospital, right? Pero, kasi it adds discomfort to the patient. Right? So anyway, gentamicin IV push and to use the highest dose possible. Alright? Now, here's the thing, class. I think what most of you guys did is, ginamit nyo na desired CPSS is 6 micrograms per ml, which I can't blame you guys. Okay? I can't blame you guys. Pero, ang instructions natin is to use the highest dose possible. So, meaning, what will be the dose that will give the highest plasma concentration, okay, na safe pa rin para sa patient. Okay? So, basically, class, sure, 6 microgram per ml is the desired CPSS. Pero since medyo nasa critical ang condition ng patient natin, sasagarin na kumbaga yung dose na pwede kong ibigay. So therefore, class, ang magiging desired plasma concentration ko, instead of 6, I'm going to go for 10 micrograms per ml because that's the highest allowable peak plasma concentration for this medication. Pero class, gusto ko lang din, example lang kasi to, kumbaga parang, hindi ko masabi, chorba-chorba lang. Okay, pero example lang muna kasi gentamicin kasi technically, class, when we're dealing with gentamicin, we don't usually go for higher peak plasma concentrations. We go for higher Cmins or higher trough concentrations. Okay, especially for aminoglycosides or even vancomycin. Okay, pero example lang natin dito class is, ang goal natin is to give the highest possible dose. So that would be, what is the dose that will give the highest plasma concentration that is considered to be safe pa rin. So that would be, of course, class, 10 micrograms per ml. Now, just ano lang pala, a quick side note, yung quiz nyo class is based on highest. Okay, so the highest score so far was 36, I think. So the perfect score class will be 35. Okay? So kasi naintindihan ko may mga iba ditong ano, I know nakakalito talaga to. So adjust na lang natin yung ano, yung scores natin. Okay? So anyway, sulat muna natin yung mga given natin dito. Right? So, ano bang given natin? Meron tayong weight which is 55 kilograms. Okay? Ano pa bang kailangan ko dito? So sabi natin gentamicin, ano ba yung VD ng gentamicin? 0.24 liters per kilogram tapos 2 hours half-life. 0.24 liters per kilogram half-life is nakalimutan ko na 2 hours, tama. Okay, 2 hours. Tapos ang desired CPSS, instead of 6 class, go tayo sa 10 milligrams per liter. Okay, because sabi nga natin, ang desired dito is the highest possible dose. Okay? So therefore, ang required natin would be dose equals unknown. So therefore, our solution would just simply be dose equals CPSS times VD times 1 minus E negative K tau. Okay, nakalimutan ko tingnan ang tau Q8. Okay, dosing interval natin is 8 hours. So therefore, gagawin lang natin would be 10 milligram per liter times VD natin. So times 55 equals, cancel, lalabas ay, check, 0.24 times 55. Get 13.2. Okay, tapos ang half-life natin is 2 hours. K natin will be 0.693 divided by 2. 0.3465 per hour. Okay, so times 13.2 liters. 1 minus E negative 0.3465 times 8. So 10 times 13.2, 132 milligrams. Cancel ang liters. Times 0.3465 times 8. Shift ln, negative answer. 1 minus answer, 0.9375. So times 132, you get 123.75 milligrams. Okay, so of course, class, the closest answer, or syempre, normally, pag ganito ang binigay sa atin, okay, 123.75, pagpipilitan ba natin to? Okay, normally, class, when I'm given a situation like this, I would usually round it down to 120 milligrams. Any dose class na mas convenient para sa aking nurse, okay, na kunin at i-administer sa patient, napasok pa rin naman sa therapeutic window. Okay? In this case, class, that will be 120 milligrams. So, any questions so far, class? Okay? Clear naman ba so far? Katanggap-tanggap naman ba ang rationalization natin?
Yes, boss.
Okay pa naman. Okay. Just in case, class, may question kayo, please feel free to ask. Okay? So, here is how many ml should be administered to the patient every 8 hours. So, kung 120 milligrams yung class, ano bang available dose natin for gentamicin? So, 80 milligram per 2 ml ang available. So, that's, 80 milligram is to 2 ml. So, 120 milligram is to X. Okay, so X would give us 2 ml. 2 times 120 divided by 80. So, that gives us 3 ml. Right? So siguro naman madali lang kunin to, right? Kaya naman siguro i-administer to ng nurse natin every 8 hours. Okay? So pwede na. O, question lang class. Kung 3 ml ang dose natin, tapos 2 ml ang per vial, how many vials would you dispense? Okay? Per dose, most likely. Or for one dose class, ilang vials ang i-dispense natin? Okay, para sa patient natin.
Sir, stock po is 2 ml per vial.
Yes, that's true. So, ilang vials ang i-dispense natin? Per dose.
Dalawa po
Okay, very
per
good.
dose.
Most likely, kasi yes, tama yun. Okay, most likely, 2 vial per dose. Pero, yung susunod na dose, isang vial lang. Kasi may natira ka pang kalahati dun sa isang vial na dispense natin. So, class, just so you know, if you're a clinical pharmacy class, those are some things you have to consider prior to dispensing the medication. Well, usually inpatient naman nagko-compute nun eh. Yung mga clinical pharmacists, yung nagko-compute ng dose, si inpatient ang magsasabi kung ilan yung di-dispense. Okay? So, yun. Now, next question is, after 3 days of treatment, plasma concentration of gentamicin at steady state were obtained from the patient. It was found out to be 15 micrograms per ml, or 15 milligrams per liter. How long should you wait until the plasma concentration reaches to the minimum allowable concentration before giving a more appropriate adjusted dose based on the desired concentration, which is 6 micrograms per ml? So in this case naman, class, right? Sabi ko, ito yung mahirap pag nanganganak yung question eh. Magkamali ka sa isa, mali ka na halos sa lahat. Okay? So in this question, class, is, ang tanong niya lang would be, how long should you wait before the plasma concentration of 15 micrograms per ml will return to the minimum allowable concentration? Kasi kung titingnan natin class sa therapeutic window ng gentamicin, okay, the allowable therapeutic range is between 1 and 10. Okay? Ngayon, ang nangyari is, naging 15 microgram per ml yung steady state plasma concentration ng patient after 3 days. Okay, so parang yung tipong sasabihin mo na lang, Doc, sana pala nag-base na lang tayo sa desired plasma concentration niya, which is 6 micrograms per ml. Okay, hindi na natin sinagad. Pero sometimes, class, it really happens. Okay, the reason why these things happen, class, is, okay, minsan, during the course sa wards or during the course of the patient in the hospital, okay, nagde-develop sila ng conditions or may mga undiagnosed conditions sila. Let's say, for example, akala natin healthy yung kanyang kidney, yung pala hindi. Tapos sinagad natin yung concentration ng gentamicin. Okay? So therefore, class, there could be some problems with the kidneys of the patient. So kaya ang nangyari is, tumaas yung plasma concentration. Kasi hindi naman sa lahat ng oras alam agad natin ang problema ng patient, right? Normally, we only find out kapag may symptoms na yung patient. Okay, di ba parang problema sa kotse? Hindi naman lahat ng problema ng kotse makikita mo agad sa isang bagsakan lang. Okay, usually, paunti-unti lalabas yun. Okay? So, similarly, class, to how the body works. So, therefore, class, ang nangyari dito is, binigay ko nga siya, wherein ang expected ko sana is 10 micrograms per ml lang yung concentration ng drug, pero nangyari, naging 15 micrograms per ml, yung actual plasma drug concentration ng patient. So, therefore, class, I have to adjust my dose. Now, before I do any dose adjustments, antayin ko munang mawala sa katawan yung excess na gamot. Correct? Okay, so antayin ko muna siyang mawala. So, how do I compute for that? Normally, class, we'll be using the formula Cp equals COE negative KT. Okay, we're in Cp, class, will be the plasma desired plasma concentration. T here would be the time at which this plasma concentration is reached. And then C sub 0, class, will be the concentration at 0 time, or the highest plasma concentration. Now, in our case here, okay, Cp, class, will become the Cp MEC. Then, ang CO natin, class, magiging CSS. Then times E negative K T. Okay, then transpose the formula, class, to get the formula for T. Okay, so T, class, ang lalabas will be ln CSS minus ln C MEC over K. Okay, to get the time. Alright? Na alam naman natin, class, diba, that C sub 0 and CSS are technically the same because this is the point at which the amount of drug absorbed is equal to the amount of drug being eliminated. Okay? So hence, ang gagawin natin ngayon would be, okay, proceed tayo sa computation. So ln 15 minus ln 1. 1 dahil yun yung minimum allowable concentration. Tapos ang K natin would be 0.3465 per hour. Okay, so using our trusty calculator, ln 15 minus ln 1 divided by 0.3465, you get 7.81. 82 hours pala. Or, sabihin na natin, 8 hours. So, meaning class, you have to wait for 8 hours, okay, before giving the next dose na adjusted na. Okay? Yung next adjusted dose mo na. That would give you a plasma concentration of 6 microgram per ml. Right? Okay. So, actually, ang nagka-problem man talaga is sa problem na to. So, hindi ko inayos yung date. Ginawa ko pang July 22, 2015. Okay? So, if the last dose was given at 800 hours, so 8 a.m., okay, when should you give the adjusted dose? So, sabi natin, 8 hours tayo mag-aantay. So, therefore, kung 8 a.m. yun, alright, so mag-count tayo ng 8 oras. 8 a.m., 9, 10, 11, 12, 1, 2, 3, 4. Okay, 4 p.m. class ng July 22, 2015, okay, natin ibibigay yung adjusted dose. Kasi after 8 hours, we already assume that the drug is already at the minimum effective concentration. Hindi naman natin siya hinayaang bumaba totally eh. Kasi we still want the drug to take effect. 3 days pa lang yung treatment eh. Okay, usually pag gentamicin, it takes about 7 to 14 days of treatment. Okay, so we don't want naman the concentration of aminoglycosides to go down too much. Or gentamicin to be too much. Go down too much. Alright, so 1600 hour class is equivalent to your 4 p.m. So technically, parang wala namang computation talaga na gagawin dyan. Okay. Next one. Most of you guys got this correct naman eh. So a 6-year-old female patient weighing 44 pounds was diagnosed with congenital heart failure and is currently hospitalized due to... Okay na to class ha. Okay. I'll just be deleting this. Okay, so 44 pounds was diagnosed with congenital heart failure and is currently hospitalized due to low cardiac output and significant edema. Her attending physician ordered 0.25 milligrams of digoxin IV every 24 hours. What is the C-peak SS of this drug if it was to be given intermittently? Okay, so most of you got this correct naman, pero sige, let's solve this na lang. Just for the sake of solving it. So weight ng patient natin is 44 pounds. Convert na natin to kilograms para hindi na mahirapan. 44 divided by 2.2, 20 kilos. Okay, 6 years old pala to. Okay, bata. Tapos, ang kanyang dose is 0.25 milligrams. Sabihin natin 250 micrograms. Okay, tapos ang dosing interval niya is every 24 hours. So, ang required natin dito class is the C-peak. So, check muna natin si VD saka yung half-life niya. Ang VD nito ay digoxin 6.7 liters per kilogram sa 1.5 days. Okay, 6.7 liters per kilogram. So, kanyang half-life is 1.5 days. Or we say class, it's equivalent to 36 hours. So, K would be 0.693 divided by 36. 0.693 divided by 36, we get 0.01925 per hour. Okay. Ang required natin would be CPSS equals unknown. And the solution, okay, so CPSS equals dose over VD times 1 over 1 minus E negative K tau. Okay, dahil na-expect natin nasa steady state concentration na yung gamot. Kaya 1 na siya. Hindi na siya 1 minus A negative NK tau. So dose is 250 micrograms over VD is, oops, hindi ko pa nagawa ang VD, times 20 kilograms. 6.7 times 20. 134 liters. So 134 liters times 1 over 1 minus E negative 0.01925 times 24. Okay. 250 divided by 134, you get 1.8657 times 0.01925 times 24. Shift L and E, negative answer. 1 minus answer. 1 divided by answer. Okay. 2.7029 times 1.8657. You get 5.0427 microgram per liter. Now, class, just so you know, 1 microgram per liter is equivalent to 1 nanogram per ml. Kasi there is 1,000 nanograms in 1 microgram and there is 1,000 ml in 1 liter. So, pretty much the same lang sila. Parang milligram per liter at saka micrograms per ml. Okay, same thing. 1 lang ang kanyang conversion factor. Alright? So, most of you guys got this correct naman. Okay, no problem there. Alright, so does the patient need dose adjustment? If it is needed, what dose would you suggest? Okay, so in this case, class, 250 micrograms tayo. Ang lumabas na peak plasma concentration is 5. And looking at the given table that we have, the allowable therapeutic range is only between 0.5 and 1 nanogram per ml. So di hamak naman, class, na it's already 5 times more than the allowable plasma concentration or therapeutic range. So mag-a-adjust tayo ng dose. So in this case, class, ano ang desired ko? Gusto ko nasa 0.8 lang siya. Okay? Now, if we're dealing with this case, class, since mag-a-adjust lang naman tayo ng dose, provided walang hindi nagbago yung VD or hindi nagbago yung K ng patient, ang elimination rate constant. Okay, pwede tayo mag-ratio and proportion dito. Right? So, ang gagawin ko lang dyan, class, would be new dose. Okay, it would be CP desired. Kung ano yung gusto kong CP. CP actual times dose na owed. Okay? So, I think andito yun eh. Ito yun, no? Ito siya, class. Ito yung formula na to. Yung gagamitin natin. Okay? Alright. So, ang desired ko is 0.8 microgram per liter. Now, ang aking actual, okay, na-compute ko is 5 microgram per liter. Tapos, ang dose na gamit ko that gave me 5 microgram per liter would be 250 micrograms. Okay? So, gagawin lang natin yan is 0.8 divided by 5 times 250. You get 40 micrograms. Okay? So, you got 40 micrograms, class. So, therefore, ang gagawin natin is, yes, patient needs dose adjustment. Kung mag-adjust man tayo ng dose, gagawin natin siyang 40 micrograms na lang. Okay? So, yan. Oops. Bye. Yan. Okay, so how many ml should be administered to the patient? Well, mag-ratio and proportion na lang naman tayo dito. I think most of you guys got this naman. Okay. Now, let's go to this one, class. Marami rin ang slightly nagkamali dito. Okay? Nakuha tama ang dose pero may mga nagkamali lang. Right? So, Here, class, we have patient CD who weighs... any questions so far, class? May tanong ba muna? Regarding sa digoxin?
None po.
Wala pa naman. Okay. Nice. Thank you very much. Okay. So here, class, we have patient CD who weighs 120 pounds. Okay. And is receiving 1 vial of valproic acid, okay, for his seizures once a day. The drug is given intermittently and the patient has normal renal and hepatic function. Is the dose appropriate for patient CD? What is the Cmax SS? Okay, so tingnan muna natin. 1 vial of valproic acid. Saan ba yan? Okay, 100 milligrams of valproic acid per ml, IV solution, and 1 vial contains 5 ml. So that's 500 milligrams. Okay, so dose here would be 500 milligrams. Okay, ang dosing interval natin is 24 hours kasi OD. Okay, and what else do I need? I need my VD. I need my half-life. Okay, VD ng valproic acid is 0.2 tapos 14. 0.2 tapos 14. Ito ay liter per kilogram. It's 14 hours. So times 120 pounds is equivalent to 2.2, 54.55 pounds, kilograms. Okay, so 54.55 kilograms, cancel, times 0.2 liters. We get 10.91 liters. Okay, so half-life, ang kailangan ko, so that's 0.693 divided by 14. 0.0495 per hour. Okay. So, is the dose appropriate? Determine the Cmax first. So, CPSS equals to dose over VD times 1. 1 minus E negative K tau. Dose is 500 milligrams. VD is 10.91 liter times 1 over 1 minus E negative 0.0495 times 24. Alright. Okay, 500 divided by 10.91. Divided by 10.91. That's 45.83 times 0.0495 times 24. Shift ln, negative answer. 1 minus answer. 1 divided by answer. You get 1.4385. So times 45.83. Get 65.9263. And that's milligrams per liter. Okay, or 65.93. All right, very good. So, is there a need to adjust the dose? If so, what should be the appropriate dose? A lot of you guys answered 600 milligrams. I believe ginawa nyo to meet the desired CPSS of valproic acid, which is 75 micrograms per ml. Okay? So, question class, kailangan ba natin i-adjust yung dose? Is there a need to adjust the dose?
Wala po.
Bakit sa tingin mo, Miss Tony? Secret, sir. Char. Okay, sa tingin mo lang, bakit hindi kailangan mag-adjust?
600 milligrams po is too much. Above na po siya nung therapeutic range.
Above na ba siya? Okay. Hindi ko siya na-compute pero lalampas na. Okay. I see. Sige. Well, one thing class you have to take a look at this one din eh. Na kailangan din natin nandito is, ano ba ang therapeutic window ni valproic acid? Okay? Kung titingnan nyo class, ang therapeutic window ni valproic acid is between 10 and 100 micrograms per ml. Pag binigay natin class ang valproic acid na 1 vial for this patient, for this specific patient, okay, ang lalabas daw na plasma concentration niya class is 65.93. Now question, is this above or within the therapeutic window? Yung na-compute nating CPSS, is it above, below, or within the therapeutic window? Yeah. Okay? Sa tingin niya, itong value na to. Okay? So I think class, it's a no-brainer to see that 65 is between 10 and 100, right? Okay. So dahil class within the therapeutic range na siya, hindi mo na kailangan i-adjust pa yung dose. Kahit sabihin natin class ang desired CPSS is 75 micrograms per ml. Okay? Kahit yan yung desired plasma concentration, there's no need to adjust it anymore kasi pasok pa rin naman sa therapeutic window yung expected plasma concentration ng gamot. Not unless class you get the actual plasma concentration and find out that it's already below or more than 100 micrograms per ml. Then that's the time you adjust the dose. Okay? Is that clear, class? Okay, plus the fact class na kung sakaling gamitin mo ay 600 milligrams, okay, magdadagdag ka pa ng isang vial just to add the extra 100 milligrams. Okay? So, pahihirapan pa natin si nurse natin. Okay? Dadagdag pa ang gastos ng patient natin kasi kailangan bumili ng extra vial. Okay? So, kung pwede class, isagad natin yan sa isang vial lang. Okay? Kung pwede naman, papasok pa rin naman yung concentration ng gamot natin sa therapeutic window, then we'll stick with that. Okay? Kung saan madali para sa nurse at mas makakamura sa patient natin. Alright? So, yun siya. So, there's no need to adjust the dose here. Okay, so how many ml? So, sabi natin, 500. Okay lang. Just stick to 5 ml. Okay, I think this one is the last question. Okay. A 12-year-old patient weighing 88 pounds. Sorry. Ayan na. So, hopefully, clear naman na yan. Okay. So here, class, we have a 12-year-old patient weighing 88 pounds and is suffering from uncomplicated pneumococcal pneumonia with no renal failure. As the pharmacist in the healthcare team, what drug would you suggest to be given intermittently and at what dose? Okay. So, class, a quick Google search would give you the answer or the drug of choice for an uncomplicated pneumococcal pneumonia, and that would be, of course, Pen-G. Okay, so ang question dito is, 88 pounds ang patient ko, bata, 12 years old, okay, ano ang, anong dosing regimen ang ibibigay natin if we are to give penicillin intermittently, IV push. Okay? So, sabi natin, ang gagamitin na dito is Pen-G. So, let's write first our given muna. So, ang weight ng patient is 88 pounds. Okay, so kailangan ko dito is VD, CP desired. Ano pa bang kailangan ko? Half-life. Para makuha ko yung K. Okay. So, class, if you notice sa Pen-G, class, wala siyang therapeutic range, right? Okay? Kasi, class, ang kinagandahan sa Pen-G, kahit ibigay mo yung class ng napakataas, okay, there will be no, it usually shows no signs of toxicity. Okay, ang pinaka-toxic effect na siguro kasi makuha mo sa penicillin G ay kung allergic ang patient dito sa penicillin. Alright? Pero class, you can give penicillin at a very high amount. Dati class na experience ko before sa hospital, we had one patient class, ang kanyang dose for, I think it was cloxacillin, I'm not sure. Or was it oxacillin? Anyway, sa penicillin siya class, 10 vials every 8 hours. So you can imagine how many gaano karaming penicillin ang binibigay sa kanya every 8 hours. Alright? Yung patient na yun sa ICU na kasi very complicated na yung infection. Kasi nagad nung doctor yung allowable dose for that penicillin. Pero anyway, so yun. 6 hours for... Okay. Class, ano ang gagamitin kong VD? 0.4 or 0.75? For our patient. Sa tingin nyo, anong gagamitin nating volume distribution? Okay? Ano sa tingin nyo gagamitin ng volume of distribution? Okay? Ang patient natin ay 12 years old. Okay. So anyway, so for obvious reasons, class, I think everyone would agree na gagamitin natin ay 0.75 liters per kilogram. You have to remember, class, sometimes ang volume distribution ng isang bata iba sa matanda. Okay, so such as the case here. So we'll be using class 0.75 liters per kilogram as the volume distribution. Okay, so tau is 6 hours. 0.75 liters per kilogram. CP desired is 4 micrograms per ml. Milligrams per liter. Half-life is 30 minutes, so that's 0.5 hours. Okay. So, kunin natin ang VD. 88 pounds divided by 2.2. It's 40 kilograms. So, times 40 kilograms. Cancel. Lalabas ay times 0.75. 30 liters. Okay, CP desired. T1 half. So, ang K code would be 0.693 divided by 0.5. 693 divided by 0.5. You get 1.386 per hour. Okay, so mabilis siya ma-eliminate. Alright. So, solution. Okay. Dose ang kailangan ko dito. So, that would be CP desired times VD times 1 minus A negative K tau. That's 4 milligrams per liter times 30 liters multiplied to 1 minus A negative 1.386 times 6 hours. 4 times 30, 120. Tama, 120. It's 120 milligrams. Cancel liter. That's 1.386 times 6. Shift ln negative answer. 1 minus answer times 0.99975. Okay, so times 120, you'll get 119.97 milligrams. So sabihin na natin, class, 120 milligrams. Right? So I think most of you guys got this correct naman. So what is the peak concentration of your recommendation? So class, you can compute this using the formula for C-peak. Yung C-peak equals dose over VD times 1 over 1 minus E negative K tau. Okay, pwede rin naman yon. Pero kung katulad ko kayo, na minsan ay tinatamad, ay gusto ng shortcut, we can do this as ratio and proportion. Okay? Remember class yung natin kayo na yung ratio and proportion na ito? XO dose mo, tapos ang steady state plasma concentration, and so on and so forth. Okay? So class, we can do this. Ang gagawin lang natin ay transpose the formula. So, dahil nagpalit tayo ng dose, ginawa natin 120 instead of 119. Okay? So, CP yung equals, wait lang, patingin lang ng formula saglit. Okay. CP CP old times dose new, right? XO new over dose old. XO old. Okay. So, expected ko dapat dito CP old is 4. Kasi yun yung aking nauna dito. 4 milligram per liter times anong dose na ginamit ko? 120 milligram divided by 119.97 dapat. Cancel, cancel. Oops. So, 120. 4 times 120 divided by 119.97. You get 4.0010 microgram per ml. Alright? So, yun yung magiging expected plasma concentration ko if I use 120 milligrams. So, napaka-minimal lang naman ang difference. Okay? And in terms of how many ml, so you can just equation proportion this one. Alright? Okay.